Hang on.
Oh, yeah, now streaming live on Facebook.
Gonna record. We're live, guys, I think.
Yes, we are.
Yeah.
Yes. Woohoo. Live on Facebook.
Woo! Okay, do you guys hang on, do you guys see a black screen or what do you guys see? Yeah.
Okay, now it's on. Now it's on. Now it's on.
Okay. Please pardon us, technical errors. I am not quite sure what's happening.
Yes, we got a screen.
Yay, perfect.
And it's moving.
Great. Hey. Yes, okay. We are live, guys.
Yes.
All right.
Okay. Hi, everyone. How many people do we have now? We have 10 people.
Yay!
Shall we give it a few minutes? 1 minute, maybe?
Always a good start.
Yeah.
How's everybody?
I think people are still finishing up their dinner.
Oh, I know why, because I kind of clicked the thing. Yes. Yeah, I guess it's dinner time.
Yes.
That's why.
And we can always say people got caught in the rain, so they need to, make sure they're not wet before they come and sit down and cozy up with us.
Yes, that's right.
Okay, who's here? Can you type in the comments and say hi so we know? Hi, Mingfo.
Oh, we're getting some live feed. Some of our members are texting to say that they are connected. Great.
Yay.
Yes, yeah.
Awesome.
All right. Go on. Grace, I think we can start anytime now.
Okay, so hi everyone and welcome to Connecting the Dots. Connecting the Dots is a weekly Facebook Live talk show by Aphasia SG that aims to answer all your burning questions about our healthcare system and health services such as speech therapy, music therapy, and social work. And also any questions you may have about brain injury and aphasia. So we're basically here to help you connect the dots.
Yes.
I'm Grace, and I'm a volunteer for Aphasia SG and your moderator for tonight. And each week we have different healthcare professionals, patients, or caregivers who will share their insights and experiences. And for our very first episode today, the topic is speech therapy. And we have 3 of our in-house volunteer speech and language therapists, Melinda, Siew, and Evelyn. Video not on, right? You'll see them later. And so to all our viewers on Facebook, we encourage you to ask questions and leave your comments freely over the next 45 minutes, and our speakers will address all your questions, or they will aim to anyway, before the end of the session. So without further ado, shall we get the 3 ladies to introduce themselves? Why don't we start with Melinda?
Oh, that was quick. Okay. Hi, I'm Melinda. I'm a speech therapist at a general hospital, in Singapore. Basically, I see patients who are very, very early on in their stroke journey or their stroke rehab journey, where they come in through the ICU or through the general wards. And yeah, so I do a lot of assessments and then therapy. Yeah, that's in a nutshell what I do.
Over to Siew.
Okay, Siew?
Yeah.
Hello, hi everyone. I'm Siew here. So I'm a speech therapist working in a community hospital, which is a step-down care from acute hospital. So I work in St. Luke's Hospital, and I provide services for inpatient and outpatient as well. So when it's inpatient is when they get discharged from a restructured hospital, they come over here and they get more rehab and prep them to go back home. Yeah, so that's what I do. Yeah, so that's about it. And over to you, Evelyn.
Hi, everyone. Hi, I'm Evelyn. So I'm a speech therapist working in a community day rehab center called ABLE. It's at Toa Payoh Lorong 8, very central. I also see patients in a private home care setting. So what we do in community day rehab center would be patients who have been discharged from the acute hospital, the general hospital, even the community hospital, but they require more rehabilitation. They would seek our services. Most of them are out and about in the community, but find that they need some help to improve and get by with their daily function. As for home care, there are some clients who prefer to be seen in their homes. Hence, they would seek our services. Yes. Yeah.
Okay. So you guys have prepared, or you ladies have prepared something for tonight. Do you want to launch into that right now?
Yeah. So Mel, do you want to share more about the work that you do in an acute general setting?
Yeah. So basically, if a person has a brain injury or a stroke, they start off in, so they usually come in through the emergency department, and then they'll either get admitted into the ICU or into the general ward, depending on the severity of their medical needs. So usually after a stroke or brain injury, the doctors will make a referral to the speech therapist if they notice that the person has a swallowing or a communication some communication difficulties. And so the role of the speech therapist in the acute hospital is actually to assess, make sure that the patients are eating and drinking safely. So that's part of what we do, making sure that the swallowing function is well and good, and to make sure that food and fluids don't enter the airway. And another part of what we do is we actually support the patients as well as our medical team, so doctors, nurses, all your other allied health professionals, to make sure that they can communicate with the patient to make the journey, the patient journey, a bit smoother and a little bit easier to manage. So you can imagine that when a person comes in for the first time with a brain injury or a stroke, it's quite a scary thing, you know, because you go from being fully independent one day to suddenly, you know, not being able to either use part of your hand or use your leg. You can't walk. You might not be able to talk very well. You might find that when you're eating and drinking, you cough and you choke. So there's a lot of anxiety and a lot of worries that a patient may face in their early days. And I think a lot of it is centered around an inability or a difficulty in communicating their needs, or maybe even understanding what other people are saying to them. So yeah, so we start there and we do assessments to find out where does the difficulty or breakdown lie, and then from there we put things in place, like some kind of communication aids, or we teach some strategies to the patients, no, not just the patients, but their caregivers and their loved ones as well, to make communication more effective. Yeah, so, and then obviously it doesn't stop when the patient leaves. So then when they move on to another setting, this work then continues. Yeah. So what about Siew? Like maybe you can, shed some light as to what happens after they leave the acute hospital.
Yeah, that's right. So usually when they're in the acute hospital, is the injury and everything is still so fresh. So they're still coping with that, just like what Mel has said. And probably they would have a shorter time in the acute hospital. So they will then transfer to a community hospital for more rehabilitation. So when they come into the rehab hospital, so what they do is that we will, as a speech therapist, we will still do the assessment and to find out what is their level now. Okay, so they will go through a series of rehab, and usually the length of stay would be typically about 28 days. Yeah, and we will continue what Mel has already begun for us. The speech therapist in the acute hospital has already started off. Yeah, so we will continue to reinforce and educate carers about the swallowing issues. We'll continue to upgrade their diet. When they come in, probably they are on tube feeding or even some modified food, and then we'll slowly provide therapy to improve on their swallowing, slowly able to take back close to what they used to take. Regular diet, for example, and in terms of speech and communication, and sometimes these stroke survivors or even traumatic brain injury patients, they do have voice issues, speech issue, slurred speech, very common, right? Yeah, so we'll continue the rehab at that in a community hospital. So of course, there will be assessment therapy and rather intensive therapy when they come over, because the focus is not so much on their medical side where they are already more stable. So it's really getting them ready to get back home. Yeah. So of course, this service, once this service doesn't stop here. Once they get back home, but they still require, like especially with people with aphasia, they may still require language therapy, sometimes with speech impairment as well, voice, and even swallowing. Then they'll come over. If they are well enough, they'll come back as our outpatient. If not, then we will also provide home therapy to further support them. And then we also try to reintegrate them back to the community. I think this community part, Evelyn would have more input on it. Yeah. So why not, Evelyn? Now your turn to share about what happens in the community. Yeah.
Yeah, so where I work, we see clients, patients who have returned home, and they still need services. And sometimes, obviously, they can try to seek outpatient services. But as what Mel and Siew mentioned, right, the hospital system, the acute hospital is obviously, as the name suggests, it's actually for acute patients. So a lot of them find that, hey, I still need rehab beyond the 28 days, beyond the 1 month, and they come to us in the community. We try to provide services like once or twice a week, speech therapy for the clients who needs communication support as well as swallowing support. Interestingly, where I work, I would say the bulk of my caseload are communication disorder cases. I have many clients with aphasia at my workplace, and there isn't even really like a cutoff date, like, oh, we must discharge you at the 3-month mark, at the 4-month mark, because sometimes we keep finding new goals to work on, even as the person keeps improving. It could be at the start something that's very impairment based. I think these terms that we use, we try to demystify it a bit. When we say impairment based, right, we're talking about this person who is a patient. We think of them as a patient, but really, as we get to know them more, it's really beyond that role, right? It's not a patient. Every person is a person, right? If I fall sick tomorrow, I really want you to regard me as a person and not a patient. Yeah. So what we try to do is to really look at it from a very holistic viewpoint, considering, what are your daily needs, and what are some of the participation and functional activities that you want to do, and what your aspirations even when it comes to going back to work and all that. So we really try to do a lot more in the community. We explore different areas as well. So in a nutshell, I actually prepared a slide. No, I think Siew, you actually have a slide about the patient journey. Perhaps we can actually show that so that it's easier for everyone to visualize what it's like.
Yeah, just give me a moment.
Yeah. And I know, this whole speech therapy thing, only because I talk to so many Grab drivers, right? I know it's actually quite confusing. Like we always get this question, so you teach people how to talk, right?
Yep.
That is just one very, very small part of what we do, really. Very, very small part of what we do. Yeah. It's so much more like that. Yeah.
Yeah. And so like what Eve is saying also, it's not just about the talking. So everybody thinks of, because when you hear the word speech, everybody always asks, hey, I better talk properly, otherwise you're gonna start analyzing me, or you're gonna start giving me lessons. Exactly.
English teacher, yeah. But you teach people to do public speaking, but we really do more than just that. Yeah.
Yeah. Exactly.
I think this is a very good diagram. I think it really sums up the patient journey, and this. It seems so simple, but honestly, nobody thinks about being sick, right? And I think this is what a lot of our members in our Aphasia SG community, as well as caregivers, struggle with. When they are at the start of the journey, they have no idea this is actually the journey. This is the path. And not everybody follows the same path. Certainly not everybody goes to community hospital, and not many actually know that there are day rehab services. So we're just putting it out there, right? These are services that are available. Yeah.
Can I just ask, right? So at the acute hospital stage where you first start, is speech therapy always recommended to patients who need it?
Wow, such a question. Okay,
Curious lah.
I would say yes, because we have good protocols in place in order to identify patients who need speech therapy. However, I must also say that some patients do fall through the cracks because, like what Eve is saying, you know, every person is just that little bit different. So so not so much for swallowing difficulties, they usually present quite similarly, but for communication difficulties, sometimes when a person presents a little bit differently and kind of falls outside the definition of a typical person with a communication difficulty, then they might actually fall through the cracks. So while yes, answering your question, yes, most of them do get referred to speech therapy, but some of them do fall through the cracks. So and I think that's maybe where sometimes when they go for other follow-ups with the either in the community or, you know, with their doctors post acute stay, then they get picked up. Yeah, hopefully they get picked up.
Yeah, actually, I do have a story to share on that point. Is that when there's this patient that came over to community hospital, was doing very well, able to converse, and he had a stroke. But then he initially wasn't really referred to a speech therapist, but then subsequently, the OT realizes that the patient can't read. Yeah. So and it was a site where language centers are, which is the left side of the brain. So that's where we picked it up and we continue on with therapy in terms of reading. So it's really interesting sometimes how everyone is just a little bit different, but it could be the same site of the stroke, but the way they present could be very different. Yeah. So I hope that answers you.
Yeah.
Yes.
That is
Thank you.
so true. Yeah. I think what Siew mentioned, right? And because, you know, we are all about aphasia at Aphasia SG, I think I just can't stress enough how every individual with aphasia is different in terms of their difficulties, their presentation. It is and hence it is so complex. So even somebody like and I'm glad the OT picked it up, right? You know, that is one dedicated and really good OT. So I mean, sometimes in the hospital settings, even in wherever we work, we do see that not everybody fully comprehends aphasia, and that can be extremely frustrating for the individual who is experiencing it. Just to relate, and just to share this story, one of my patients whom I'm seeing, she still goes back to the hospital for follow-ups, outpatient, not for speech, but other stuff. And every time she goes for one of these appointments, right, she comes back to me and it becomes a rant fest because she will say, you know, they are so impatient. Everyone I meet in the hospital is so impatient with me. From the counter staff to the healthcare professional that she's seeing, you know, I tell them I have aphasia, but it's almost like they don't understand what I'm talking about. And to give context to this, right, this particular person has receptive aphasia, meaning she actually has more of a comprehension, auditory compre issue. She has some word finding difficulty, but it's not very apparent to the lay person. And she looks well. She has no physical impairment. So to the person on the street who sees her, they will just think, oh, you know, it's just somebody who's speaking maybe perhaps English is not her first language, or maybe, you know, or something like that, but she has rather severe actually comprehension issues, but well enough to go about on her own, but extremely frustrated at every single one of these hospital encounters, you know, as an outpatient. Yeah.
So I think like tagging on to that as well, it's not just as an outpatient that I think patients will feel frustrated. So it's just to share about how, you know, as an inpatient therapist, we are expected to, you know, be very, very productive and be able to get to as many patients as you can in a day. So I feel like in that situation, not that I'm defending anybody, okay, but I feel like in that situation, sometimes people feel like they don't have the time of day to sort of change the way they do things, or change the way that they are interacting with another person, to be able to get the message across either way, right? So I feel like if, let's say, you were speaking to a person who cannot understand your language at all, you would actually maybe bother to pull out your phone and, Google something, or at least Google translate something, to say like, oh, can you follow this, or you translate and then you play it for the person to hear, so that at least you try and minimize those communication barriers. But I feel like if it's not a known language barrier, then people don't feel like the communication barrier is actually a thing. They might just think, yep, no time for this, gotta go in and do what I gotta do, and I gotta get out. So that does make me feel sometimes a little bit frustrated, because there are some strategies that are, it seems also maybe very common sense, but maybe people don't really think about it sometimes because of other stresses that they might be facing. So I think that's something that it's not just an outpatient thing. Inpatients would probably also feel that same level of frustration. Yeah.
I think that's a really valid point. I actually prepared a slide. I mean, since this episode is actually about speech therapy, I thought it would be good to just tell everyone what we do as speech therapists.
We do see a variety of clientele actually.
Oh, wait, hang on. Nope, that's not it.
You've jumped to the good part.
I jumped to the good part. Yeah. So well, this is pretty much in summary. I tried to illustrate what we do. So obviously right at the top in gray, we have language and communication, and aphasia is really a part of what we do. Aphasia would refer to acquired language impairment. So that's the left side of the brain, but obviously some clients with other kind of brain injuries on other parts of the brain would suffer from more of a cognitive communication impairment or deficit. So we do intervention for them. Also we talked a lot about swallowing, because it is a life-threatening condition if you have dysphagia and it's not treated, or some patients could actually end up with aspiration pneumonia, chest infection. And then there's also the component of speech. I just want to say that apraxia that you see over here, apraxia of speech, often coexists with aphasia. So we treat it together at the same time. And then there's fluency, which is more commonly known as stuttering or stammering. If you watch King's Speech, you will know that. And then voice, there's some very famous singers who have gone for vocal surgeries, right? I think Steve Tyler and all that, And AAC refers to alternative and augmentative communication. So sometimes when a person has a degenerative condition, they might need a certain kind of augmentative devices to help them communicate. So it's no longer just about improving the impairment, so to speak. And there's this little population serves, right? Do you guys want to explain what all that is about?
Sure. So we see anyone and everyone, starting from infancy. So you see like the little baby, little photo of the little baby, all the way to children, adults, and then even the older adults. So all the way to even maybe end of life, depending on the type of needs that they have. So I think just to jump in, I think the AAC part for that Eve was trying to sort of elaborate on. So I like to give this example when people talk about, so what do you mean by augmentative? So by augmentative, we actually mean to change or to modify, right? So one example that I like to give is actually like the use of a microphone. So if let's say I am standing at one corner of an auditorium and my voice isn't loud enough to be able to be heard on the other side. So an augmentative tool that I could use is actually either a microphone or something like a loudspeaker, in order to project that voice across, to be able to communicate with someone at the other end of the auditorium. But an alternative, maybe it's a little bit more intuitive, where it is something that replaces something else lah. So so that's what AAC stands for, and we love our acronyms. So yeah, acronymize it.
Just to add on, is like for adults, we talk a lot, we stress a lot about swallowing, but for infant, why are we seeing someone who is a baby? It's because feeding issue is another big issue. If a baby can't eat, swallow properly and swallow properly, that's where there's a big role that speech therapists play as well. And if children in that sense is children with special needs, children with autism, children with Down syndrome, these are the areas where we do help. And there is where the use of AAC will come in to help them to communicate as well. Yeah, so, and in terms of speech as well, they would have some slurred speech issue where we can guide them through to communicate their thoughts better and their needs better as well. Yeah. So we do cover a wide range of population. Yeah.
Yeah. Not just about talking.
Okay, sorry ladies, can I just interrupt for a minute? We have a question from our Facebook Live audience. One is asking, Clarissa Na, can you share more strategies, basic strategies for communicating with patients with receptive aphasia?
Yeah, that's a really good question, and it's something that we were gonna talk about. I mean, because we're gonna share about supported conversation. So yeah, I mean, thanks, Clarissa. It's a really good question, right? Because we often think of aphasia as an expressive thing, but really the receptive part of it is, I think, even more debilitating, if you ask me. So what we do at supported conversation, one of the strategies we use, right, is to just write keywords. So in order to, so I'm going to use the case study of the patient I talked about. I actually do teletherapy with her. On top of face-to-face, and whenever I do teletherapy, how do you do tele rehab with someone who has a receptive auditory disorder, right? I use a lot of keywording. So for example, I would do something like virtual screen, dang, yeah, okay, but yeah, you know what I mean, right? Yeah, so I would do like, this is not working out, yeah. Yeah, but I would keyword, I would keyword.
Actually,
so
we also use, like, now we have share screen, right? Then we would just use whiteboard.
Yeah, that's right.
Just write in like hello, you want to talk about
great. Awesome.
Yeah.
Example, or you want to talk about how is your like how is your family members? Then we can just write down the keyword family.
Yeah,
for
that's
example.
right.
Yeah.
And on top of that, when I talk to her, I obviously slow down my speech rate. I use simple as well as short phrases, right? So now I'm slowing down, and it's short. And I use very universal gestures. So for example, like, do you need to have a drink? Have you had your lunch? So these are very intuitive, and these are just some tricks out of the our speech therapist bag. If you're interested, join our supported conversation training, and you can find out more. There's so much, but I would say one of the really most important and overlooked thing is just to be patient with anyone that we meet who seems to communicate a bit differently, or they're giving you this very quizzical look when you're talking to them. I would say just be patient. Because we don't know what they're going through, right? Like, just do a mental count of 10 seconds before we start shooting off questions. I mean, so in summary, I mean, these are some really practical tips to find out more supported conversation training.
Now you mentioned just now also that it's kind of like speaking to someone who does not understand the same language, right?
Yes, it is.
So we have to like just using the same visual cues, or pictures on your phone or something, that helps a lot as well.
I mean, it's quite intuitive, isn't it? That if you are talking to someone who isn't speaking the same language as you, I mean, haven't we all been to a place where we can't speak the language and we try our best to have a conversation, but you see, that's the thing, right? Because when we are in a different country, or maybe we are talking to someone who doesn't speak English, or we give leeway to that person, but people don't give leeway when they can't see when the impairment is invisible.
Yeah.
There is no leeway given to persons with aphasia, especially if it's receptive, if it's of a receptive impairment. Yeah.
Yeah.
I think that is
Yeah.
the most challenging part of it. Yeah.
And
It
to
is
add on,
actually.
yeah, to add on to what Evelyn said, I think Evelyn actually prepared a slide to share that, you know, aphasia really affects different people at different age group.
Yeah. Let me just pull it out. Yeah.
Mm.
Yes. Indeed. Yeah.
Yeah.
And
It-
There you have it.
sometimes they're walking, you know, they're walking, you don't see the typical weakness in one side, and yet they have difficulty in speaking. So it's really invisible. Yeah. Mm.
Yeah. So once again, we urge patience, we urge understanding, and just kindness lah. Just basic kindness when you meet someone who communicates differently. Yeah.
Mm.
Yeah.
Yeah.
We have another question, sorry, from Teo Ki.
Oh, we're happy. You shouldn't be sorry. We're so happy to answer questions. Come on, ask
Oh,
your
I'm
questions,
sorry
man.
to
Yeah.
keep talking over you guys. So what is the difference between dysphagia and aphasia?
You guys want to explain?
This one is, I feel like it's a dictionary question.
Apparently this is one of the top Google search questions, right? What is the difference between
wow.
dysphagia and aphasia? So this means like part of, and just dictionary explanation. A means all of, right? So dysphagia and aphasia mean the same thing. They mean the same thing. But what I understand is actually in the speech therapy world, we have moved away from dysphagia because this term is so similar to dysphagia, which is swallowing impairment. So now everyone, speech therapist, uses aphasia, but you will still see doctors writing dysphagia because dysphagia, right, means part of lah, whereas aphasia means all of, right?
Yeah. So and I want to say this, right, about what you said, Eve. So I think it is the best move to move away from dysphagia because I have seen many times somebody writing expressive dysphagia, and I'm like, so is the person vomiting? Okay, so insider joke, this one, insider joke. But you know, I'm really glad that we've moved away from it.
Yeah.
Maybe so because the person writing also has dyslexia?
Unlikely. They just got their terms confused. They just got their clinical terms confused. So yes, aphasia and dysphagia, same thing, but stick to aphasia because this is what you know, the speech therapy world, everybody is now using aphasia. Yeah.
Okay.
Good question though. Good question from Kikun. Yeah.
Yeah.
And you mentioned supported conversations. Do you ladies want to start launching into that now?
Yeah. But I think okay, I mean, before we talk too much into supported conversation, right? I guess the question maybe people will be wondering or asking is, why bother? Why care? You know, what's wrong? Why bother fixing anything that's not broken, right? So I think we just spend a little bit of time sharing some of the challenges we see our patients, clients facing in our various settings lah. I think Mel touched a little bit on what you saw earlier in the inpatient. Is there anything that you want to add on? Yeah.
I think that is one of the things, because I feel usually in an acute hospital, time is always of the essence. And everybody is just trying to get to the next patient, because in this sort of time sensitive kind of setting where, you know, every second actually counts, and if let's say you are slow to respond, you know, to a certain call, it could actually be life-threatening. But that being said, it doesn't mean that, you know, having a communication difficulty is not life-threatening in that sense, but it is very it is very emotionally distressing. So, you know, just like what I think we have been sharing, it doesn't just affect the person who is who has the aphasia, but it also affects the family members and the loved ones, because, you know, imagine you're trying to provide some, you know, reassurance, right, or some support to you, a loved one who has just had a stroke, but your loved one actually doesn't understand you. And if your loved one doesn't understand you because of an aphasia, and you don't know how to, get through to the person, as a caregiver and as a loved one, you probably feel really lousy. And with all the different things that the doctors are telling you, that the therapists are telling you, it could also then impact that relationship that you have with the person with aphasia. So I think it is it's just wanting to advocate for maybe healthcare workers to play their part in, just tweaking very, very slightly how we communicate with people with aphasia, or anyone in that matter, because it may not just be people with aphasia with communication difficulties, especially in an acute setting. But trying to just, like what you said, be a bit more patient, count to 10 before you jump in and ask more questions that may not necessarily help the person with a communication difficulty. Yeah.
I mean, I think all healthcare professionals should be trained in supported conversations.
Yes,
When I did the training, right? When I
Yes.
did the training in Aphasia Institute in Canada, the government actually funds the healthcare workers to be trained. It's almost like a mandatory kind of training. In my class, I had paramedics sitting next to me taking supported conversation, because they would also come into contact with persons with aphasia, or just people who speak a different language. And it's great, it should be made essential for all healthcare workers to learn how to communicate with someone who communicates differently. Yeah.
So true.
I guess, I could share some of the experiences I see or challenges of the patients in my setting. So in the community, I think the group of clients I see, especially at ABLE, because they are of a younger set, we take in clients who are of employable age, because a lot of them have return to work aspirations. I see the struggles that persons with aphasia have when it comes to returning to employment. It could be even returning to an existing company. And the challenging part is, one, I think there is lack of understanding about the condition itself, aphasia. It ties back to what we said earlier about, they see it as maybe a speech impairment, but it's so much more than that, right? And then also, because of this lack of understanding, then there is this I think inability to be really inclusive. So I think it feels almost like the whole inclusive employment movement, right, only supports persons with physical disabilities and not communication disabilities, right? Which is so disturbing, because they are still intelligent. We know that our friends with aphasia, they are still intelligent, they have so much to give, but they're not able to actually return to gainful employment, simply because employers are not learning enough about aphasia, or so that's part of what we do as well. We really want to be able to train employers, and companies and organizations that care about inclusive practices, right? Come to us and learn about supported conversation. We'll be happy to train you. And I think, Siew, you also have some stories to share, right, at the ComHos?
Yeah, definitely. And community hospital, and although they come out as outpatient, the time to spend with them is still very limited, where there's still a lot of goals, discharge planning, and when should we discharge a client with aphasia. But the fact is that research has shown that people with aphasia, chronic aphasia, more than a year, can continue to improve on their their communication function. And each time, each part of their life, the different phases of their life, their communication needs change. So it's kind of like in a dilemma, for I think a lot of us here as therapists, we sort of like, we know they need it, but we can't afford to continue providing sometimes because of the resources that we have. So, and I think another way is that that's also what Aphasia SG is doing, to allow this group of people at least to continue to practice on their communication, and to get that support from that community. And it's quite sad, when in the community hospital, sometimes some doctors even, they don't fully understand what aphasia really is, and therefore it may lead to very different diagnosis. So and very quickly sometimes they just got linked to cognitive issue, and this wrong diagnosis will carry with that patient throughout. Yeah. So and that will limit them from their decision making. Yeah.
Yeah.
So
have you guys ever met patients with aphasia or persons with aphasia who are screened on MOCA? So MOCA is actually the Montreal Cognitive Test. Okay, the one that Trump was like assessed on supposedly. I mean, so it is a test
Did
that
he
is
fail?
very.
I bet he failed. Sorry,
I don't think he failed, because to fail it, okay, you must be very, very sweet. But yeah, the thing is, this test is very linguistically demanding. Okay, to test.
Yeah.
So a lot of IQ tests, a lot of tests are structured this way, but it is not fair for a person who doesn't speak the language. It's like saying that you don't speak Greek. Now I'm going to test your cognition in Greek, right? How is that fair, right? And then they get labeled that they are unable to, cognitive difficulties, unable to, no mental capacity to make decisions.
Yeah, like MMSE and things like that. It's also language based. Yeah.
And like what Siew said, this kind of diagnosis, right, when it's made by a healthcare professional, stays with the person for a long time, unless the family members are. So that's one point I want to say. Family members, if you're listening to this, if you have a loved one with aphasia and you know that they have been wrongfully diagnosed, fight for them, okay? Advocate for them. And I say this really from a healthcare professional point of view, because not everybody understands aphasia. If you find that, hey, my spouse, my child, my dad, has mental capacity, fight for it. Yeah.
Yeah, and really, just to jump on that is that to family members as well, because aphasia is a long journey, but don't give up. Keep trying and keep trying and keep trying, because they can improve a little bit at a time.
Yeah. And I think your support is also really, really important to them. And a lot of times, and I think the literature shows this as well, like a person with aphasia actually feels a huge sense of isolation, because I mean, imagine, you can, if you go through your day, we talk about now working from home and everybody feels like, they're an island and, everybody's socially isolated. Imagine what it's like for a person with aphasia. One day you're out and about, you're independent, no issues communicating. The next day you're suddenly slammed with, like you're in a prison where your thoughts can't get out. Maybe if people are sharing something with you, half the time you don't really get what they're trying to share with you. It's really, really isolating. So so if you know a person, with aphasia, friend, family, loved one, that support is actually really important. And communication sometimes is beyond words. Even sitting next to the person, holding their hand, we say silence is golden. This is when silence may be golden. And that is where you can show your support, by just being there for the person. And just showing that you care, I suppose, because sometimes that's all it takes for the person with aphasia to just, take that step, to connect with somebody else. Yeah.
A really good point now. I'm just gonna quickly, I know we're almost out of time, but I'm just gonna share this slide that I think is really pertinent to what we're talking about. This is a framework that we use for measuring the outcomes. I know as clinicians, we love measuring outcomes, and this is living with aphasia. So we urge every person to really, look beyond the, I'm just gonna annotate, right? Like, you see how as clinicians, we are always just looking at this part, treating the impairment, but really we need to consider the person who is living with aphasia. And what we try to do at Aphasia SG is we are setting up the environment, we are allowing the opportunity for participation, because we really want to engage and encourage participation to prevent social isolation. And we also take into consideration, obviously, the personal feelings and the attitudes, and the person's identity. In other words, I'm saying just consider this person with a communication impairment as a person and not a patient.
And going back to what you have just talked about, this is really why speech therapy is that important, right? It's because you guys really understand what they're going through. You know the tools that they can use to to communicate with, you know, at least you can bridge that barrier, right? And then teach the people around them and teach them how to communicate with others, well, with persons with aphasia, right? So, what?
Well, of course, gonna say it's important lah. It's our profession because yeah, it's very important.
Yeah, and it's also great that you have come together, speech and language therapists, to start Aphasia SG, and you have this community as well, which, like what Melinda was saying, is so isolating, right? To be like locked in your own head with your thoughts and not be able to express them. So Aphasia SG, you have what kind of activities do you have? You have Chit Chat Cafe and music therapy, the choir, right?
Yeah, so we have a choir. I actually have a slide on that as well. So this is about supported conversation. I didn't show this, but yeah, it's really about, you have RAMs and then you have communication RAMs. But yes, about us at Aphasia SG, so we organize community programs to empower persons with aphasia to lead meaningful and purposeful lives. But we are also about reaching out and building inclusive Singapore. So yes, Grace, you mentioned Chit Chat Cafe, that's us, and then we have the choir. We recently did a virtual performance for IMH, that was great. We run our programs virtually right now because of COVID. So we have moved our Chit Chat Cafe online. We have our Aphasia SG choir. We have games and craft night organized by occupational therapy students. They're great. We also have training workshops. And we have upcoming Chit Chat Mandarin. I think this is going to be of particular interest to a lot of our Mandarin speaking friends. Stay tuned for it. It's coming up in November. And we also have a befriending program. It's not online. It's actually really to support our community of persons with aphasia who have kind of fallen through the digital cracks. We know that not everyone has the good fortune of owning a laptop or being so adept with technology. So we really want to reach out to our members of the community who are not so keen to come online. So we haven't forgotten you. And we're gonna have a befriending program just for this group who have really, I think, kind of fallen through the digital cracks. Yeah.
How are they supposed to find out or get in touch with you for this?
Well, obviously there's our beautiful website, the one that you created for us. So you have our contact details. Yes, and here's our email address. You can get in touch with us at info@aphasia.sg. And if you want to learn more about our programs, if you want to learn more about supported conversation training, so write to us. And we also do this thing called Aphasia Experiential Workshops. This is really good for organizations that are keen to let their staff have a sense of what it's like. We recently did one for Singapore. It was great. They were really kind. The Singapore, they actually engaged us to train some of their staff, right? Not really train, so it's not supported conversation, but it was actually a aphasia experience where we did human library. So we had Sherin, one of our participants with expressive aphasia, share about what it's like to have aphasia. And we also did like aphasia games. And all these are like aphasia games that, where they get a chance to experience what it's like to have aphasia. Yeah, so things like aphasia hangman. Yeah, so it's fun. So get in touch with us. So our Facebook moderators, please write the links. You guys know what to do. Yeah.
Anything else that you want to share before we wrap up?
Yeah, I think one final phrase from everyone. Yeah, Mel, you go first.
Oh, you always put me on the spot. Actually, brain cannot work.
It's okay.
Okay, last words.
Anyone can go first. Anyone can go first. Yeah.
Right, so I'll go first. Yeah. So I think I want to take this opportunity to really, really urge everyone, whether you're, especially if you're a healthcare worker, healthcare professional, to be trained in supported conversation techniques, because you are the first person this group of people will be meeting and talking to. You are the first person to let them know that it's okay. You can still continue living in this, in this community. So get yourself trained, know about aphasia, and find out more, and just give them more time to understand you. Yeah.
Yeah.
All right. So that's from me. Yeah.
Whatever
Mel,
she
you wanna go?
said.
Yeah.
Whatever she said. And also I think I just wanted to say thanks for listening. Thanks for spending like the last, however long with us, just listening to us talk about the work that we love and the people that we work with. And I think it is the people that we work with that really make it special.
So yeah, I agree. I concur with everything that the others say, and just everyone be patient, be kind, and yes, just remember this thing: supported conversation. Okay, Aphasia SG is here to support anyone who wants to learn about supported conversations. Yeah. Just gonna have one final screen share. Grace, you can maybe just tell everyone about this. Can you guys see the screen?
Okay, so next week we are going to continue with this weekly, Facebook Live webinar. Not a webinar, sorry, talk show, Facebook Live talk show.
Same,
And
but
we're gonna
different.
have Nazri. He's a friend of mine, an ex-colleague even, and he's going to tell us about his journey from patient to volunteer with Aphasia SG. He's a stroke survivor, and now he's, if you look at him, you would never guess that he had a stroke. But so really, all the therapy has really helped him out, and I think it would be really encouraging for everyone out there to just listen in to what he has to say. And we're going to wrap up for tonight. Thank you so much, Evelyn, Siew, and Melinda. They are very dedicated, not just speech therapists as professionals, but volunteers as well. Because, before we had this lockdown and all COVID, every week they would be doing something for Aphasia SG, for persons with aphasia and their caregivers. So I think they're really amazing and very, very dedicated. And thank you everybody for joining us tonight, and we hope to see you again next week, same time, 8:30 on Facebook Live with Aphasia SG. Thank you. Good night.
Good night.
Thanks, Grace. Thank you so
Bye.
much.
Bye.
Bye.
Bye.